group to come 6 months before the Joint Commission survey or a year before and fix the paperwork. Now, what is the equivalent?
Yeah.
If I gave you the results of your exams, tests, multiple choice before you get the test, will you pass or fail? Now, what if I took an examiner from the Joint Commission to take my exam instead of me? Am I going to fail or succeed? Now you understand the principles. Look at this. What's the number one most important cause of broken hips in hospitals? Sorry? Falls. It's not a doctor's fault. There's not enough staff. As far as I know, neither Gray Davis nor Governor Schwarzenegger signed a bill that was passed by both the House and the Assembly and the Senate of California for a certain ratio of nurses per patient. We don't need to have a full-fledged RN to help patients come off the bed. But this is the number one cause. Now look, this is good for hospitals. Why should the patient go home? Patient gets a broken hip, stays a little longer. I want you to understand how severe the problem is and where it comes from. I'm going to submit to you the United States as one of the finest systems of safety when it comes to the airline industry. Last year was the year where they had the least crashes and incidents and mortality. Least from ever. Why? How come? How come it's safer to fly than it is to drive your car, be in a train, let alone be in a hospital? In a hospital today in the United States, but it's at least the equivalent of one jumbo jet crashing a week. The airline industry would be broke and you wouldn't fly. You would drive or take a train or a boat. So how come the airline industry and transportation in general is so safe? There are three reasons, and all three are necessary. Number one, you have a black box. Contrary to the foxes and the wolves that I described in the healthcare industry, which are supposed to be the black box. It's called peer review. Why has it failed? I told you. How can we make it work? Simple. Instead of taking the CEOs, COs, administrators, and physicians on staff of the hospital, Marcy said, let the physicians make the decision, and I agree with her. But the physician should not know who is the other physician, nurse, or pharmacist. The physician should not know which hospital it is, which state or city it is. It should be a generic chart. If you take any complication or error that happened to any patient in the country, you remove the name of the physician, pharmacist, nurse, the name of the hospital's ownership, the name of the city or state, or the patient's obviously name is always hidden. It becomes a generic textbook case now. In that kind of atmosphere, I don't want the patient or the hospital to know who are the 11 physicians and maybe one nurse, one pharmacist, and one CEO among the 11 from the same specialty. I'm an obstetrician gynecologist. Why should I understand neurosurgery? Why should a neurosurgeon understand what an internist did? It should be from the same specialty. Sounds logical, but that's not how it's happening right now. They don't know me, I don't know them. And that resolves a major problem of the Medical Association trying to protect through immunity the physicians on the peer review from any liability. There's no way that such physicians can be sued, either by the accused physician, nurse, or pharmacist, or by the hospital, or by anyone, because I'm not going to tell you who they are. And they know who you are. So they cannot have any feelings for you or against you. And this is how we can create a human black box. But that's not enough. Why is the airline system so safe? Because as soon as the black box reveals to the FAA, the Federal Aviation Agency, that it is a screw in the tail of the DC-9 that caused the Alaska airline to crash in the Santa Monica Bay, guess what happens? The FAA doesn't go to the Department of Justice to go through 10 years of litigation. No, sir. A second later, all DC-9s are grounded. Thank you very much. And every single DC-9 cannot take off until that screw is checked. About 2 or 3 such screws were about to break before those DC-9s were about to take off. But even better than that, the FAA was able to identify the mechanic that failed to do his job, which is in the manual of the DC-9 manufacturer, is you're supposed to grease that screw, because if you don't, it's going to break. That's not enough. You need a third leg to have a system that is safe. And that's the Veterans Administration is testing it right now, and that's NASA. What do I mean? To avoid retaliation and suppression and the code of silence and the chilling effect of fear permeating the whole healthcare system, we need the same as what we have for criminal forces and the FBI. You need a channel of anonymous information. So when a pilot over the ocean in the Pacific or the Atlantic finds out that another pilot is too close, he doesn't want to give his name. He doesn't want to snitch. He goes to NASA. NASA will then filter out the names of those pilots that fell asleep recently. That's how we learned about it, because it was reported by the tower control of the airports trying to find out why there's no response, and they were asleep. So we need those three legs. We need to create a bona fide equivalent of the black box, and it's not a Microsoft software device. It's a concept where we have a jury pool, basically. And most healthcare providers, physicians and nurses do not actually participate in jury pools in trials because the attorneys usually don't want them, because you can take the whole jury in one direction or the other. And we usually don't want to waste our time because we have patients to take care of. This is a way for our healthcare providers to do the actually civic work and improve. But we need the equivalent of an FAA or FDA. The FDA can eliminate fen-phen, the most popular drug on the market, by the number one pharmaceutical company, Pfizer, just like that, in a second, because a medical British journal reported that fen-phen can cause heart problems. And fen-phen is out the window in one day. And so this is what we need. There is a solution, and it's an American solution. We don't have to go anywhere else. I thank you very much. I welcome any questions.
Are there any more compelling questions from the audience? Ralph, website?